We also worked on the policy for the government to have some kind of legislation to to avoid any mishaps. There was a traditional medicine specific things that one of our people are doing, and then they involving the industries, those who use kind of equipment. Uh, but nowadays, we were more involved in the last, let's say, since COVID, on the ethics countering infodemic, what the WHO call it. That was another issue that we're having, because now there is a concept that you can get problems without deploying biological weapon. Only the social media, handling can cause a fear, sort of a problem in the society. And then we were through open science. Uh, we were pledging. I was the Secretary General of Pakistan Academy of Sciences. So inclusive participation, equitable collaboration, and promoting cognitive justice. So that is that our team, we were working together. The bigger problem, I think it's everywhere, not only in Pakistan, that scientists spend very little time with public, or you call it for the public awareness, I will call it, because a normal science, this is from one of the publication, though it's a decade old publication, but still it is almost the same. Scientist is expected to do research almost 50% of his her time, then administration maybe 16 to 20%, and teaching maybe a quarter of his time. So the communication time is really almost non-existent. So that's another issue that they are cut off from the society. Uh, that is an issue that we had to focus and bring them to talk about the subject. Uh, um, when we talk about international education network, there were several aspects of it. Like we were promoting cultural exchange. I myself went to Bradford and to many countries, and my students, we had a very good project with U.S. National Academy of Sciences, where we, on one hand, we sent our students to different countries to get inter disciplinary training to understand the zoonotic origin of diseases, etc., environment, animals, and plants. So we facilitate academic collaboration internationally, sharing our resources, our knowledge, and getting their resources, enhancing quality education, fostering global citizenship that through international program, broader opportunities, learning from each other. That skills are, intercultural competence, leadership, and social responsibility. And then addressing global challenges, of course, these pathogen doesn't need any passport or visa to enter into another country. So there is that you need to understand the global challenges associated. If you talk about the global risk, even today in 2024, this report from World Economic Forum, it's still 53% people now, as I said, is about misinformation and disinformation, AI generated information that are spread sometime, and that is one of the risk that as greater as almost extreme weather, or social political polarization. So this played, and there are several examples internationally between two superpowers or others that happen. Uh, Misinformation has played a role. Then cyber attacks, of course, to it, outbreak of armed conflict, and release of biological agents. Now, almost 10% of the risk, the people consider it as a major risk in 2024 that they can arise. When I talk about disinformation and epidemic, very quickly, in our country too, there is anti-vaccination movement, and that's why we cannot, finish polio from our country. And this happened not only in developing countries like Pakistan, in other developed world too, including USA, that there was a movement against vaccination. So this threat is for our specifically when I talk about polio that we could not finish it, and then because of social media, a lot of problems which delegitimize science and mistrust on the government responses, preventing people from seeking treatment, for example. or stigmatization of those who are infected with the disease. Uh, so these are political sentiments, for example. So in this context of delegitimization of, expertise by social media of the science, that is that we had to confront with, and we try to have some sort of, campaign to overcome such kind of negative, in our region. Now, when we talk about the pathogen transfer, so we have to understand, uh, of course, you're all expert, understand this. So very quickly, this has a lot of, problem, impact on public health, on emerging infectious diseases, One Health approach, antimicrobial resistance, vaccine development, economic impact, global health security. All these, when you talk about these subjects, that is that you have to understand the pathogen transmission that has an impact on this. And through these major areas, you understand the things. Now, from COVID until now, we were doing several, webinars, workshops, physical, hybrid, like today you are having one. And you look at the screen, I have only mentioned few of them, that we covered almost many of the areas that are of dual use of concern. And my friends all over the world participated from Bangladesh, Nepal, Indonesia, UK, Japan, China, Sri Lanka, Turkey, Korea, Vietnam, you name it. And we were, thanks to all of them, that they participated and they shared their views. And we discussed all the issues like sustainable development, SDGs impact on this, like nanotechnology, what that can happen, artificial intelligence, and the different countries' perspective, biodegradable surgical face masks, for example, what to do with those masks that were thrown in the dustbins, etc., and so several others. So we try to have an impact and try to explain everything to them. When we talk about our plan that we do, we had memorandum of understanding, we had collaboration with several, both national, international, and local institutes. When we talk about the local institutes, so almost every organization we try to work with them, with the universities, with national organization like a PRC, for example, agriculture research, Pakistan Council of Science Research, uh, Pakistan Biosafety Association, ministries, science foundations, higher education commission. We tried an academician. I was the secretary general, so we tried to approach everybody, knock every door, and we worked together about this. We did publications too, like one is on the IAP website, dual use of concern, and our work on dual use of education. So that is already there. So we published several articles on this, and then when we talk about the key stakeholders in international education network, they are the government agencies, they are the education and research institution, they are international organizations like WHO, FAO, UN agencies, non-government organization, industry representative, the funding agencies, professional associations, students and trainees, all we consider are the stakeholders when we talk about international education network. Excluding any one of them will have an impact on our efforts that we are working together. When we talk about the global partnership, again, we interacted, as I mentioned, with academies of sciences, with like Latvian Academy, with Commonwealth Academies, with UNESCO. I remain co-chair of World Commission of Ethics in Science and Technology. There we talk about this. UN agencies, with China, we had with the Chinese Academy of Sciences, and also we had worked with almost everybody on this and tried to convey the messages. One of our star project, I will call it, was on One Health research that we work with the U.S. National Academy of Sciences. These are the young fellows that we sent selected from the Pakistan. Pakistan, a huge country, 240 million plus individuals. We selected people, young people, and we sent them to various organizations sponsored by US National Academy of Sciences, and they were trained interdisciplinary and work on that. So for future, the strategies for capacity building through education and knowledge network, that is we do and we recommend gap analysis, a tailored program, diverse learning method. This was one that today we are meeting together. Collaborative learning environment, expert facilitation. I wish that in future this London Metropolitan gets some resources and invite all of us to be in London so that we work together, promote lifelong learning, cross-functional training, interdisciplinary partnership and collaboration, and recognition of the work that is done by several things. Now, role of research and innovation in this, why we need to do not only education awareness, but research and innovation too, for the specifically biosecurity challenges. That is, that we have to understand the disease dynamics, specifically in the modern tools like AI, machine learning, and all this. Diagnostic tools, for example, genomics and vaccine, for example. We are working on that. Vaccine development and then therapeutic, personalized vaccine, for example. The future is there. Surveillance system, early warning system, capacity building, and policy development already there. There are several new things coming up, and there are several good examples, successful research initiative in the world, like global health security agenda, like messenger RNA vaccines, like CRISPR-based diagnostic, like global virome projects, One Health approach, public-private. There are several Bradford and London Metropolitan's effort towards awareness and providing education material. These are the good, successful, I call it, research and innovation project for biosecurity. But we need to robust policies. Because of time, I'm just skipping this a couple of slides, but we have to have policies to prevent it, to regulate it, to international cooperate it. We should have a surveillance monitoring system, response and preparation for planning, ethical and legal consideration, and adoption of emerging threats. For future, we have to have enhanced the biological and biosafety infrastructure. We have to develop very good surveillance system. We have to develop the capacity of disease diagnosis and response, promote research and awareness, strengthening our regulatory framework and legislation, fostering international collaboration, and addressing socio-economic determination of health, public awareness and education, of course. There are several opportunities now. There are modern things available. There are investment in surveillance. There are capacity building and training programs. Today's example is one of them. There are enhancement of laboratory infrastructure. These are the good things that we are already having, and we are proud of that. Thank you very much, specifically all the colleagues in your university. Thank you.
Okay, thank you very, very much that you give us